Here we go. All right. Good morning, good afternoon, good evening to all of our ISCT members listening around the world. I am ending my Monday here with you all, and our guest is starting her Tuesday with you all. So I have tea. Hopefully, she has something stronger with caffeine in it, but I am delighted to welcome to the Telegraph's Common Yap. She is a PhD candidate at the University of Melbourne and works at the Peter MacCallum Cancer Center there. So, welcome. Thank you for being with me.
Thanks for having me today. Yeah, it's a
So,
great opportunity.
yeah, of course. So, you are the latest in a long line of first time ISCT attendees, which was spoiler alert. You won the top abstract award at the Australia New Zealand Australia New Zealand regional meeting this summer, right? The top abstract award. That's amazing. Congratulations.
Thanks.
That is so exciting. So, um, yeah, let's just start there because, well, I was so jealous of everyone who got to travel to go to that meeting. But you've done a lot of traveling in your life, I saw. So you're like a globe trotter when it comes to research. So you've done research experiences in London, Malaysia, and now Australia. So I wanted to ask, like, what have you enjoyed about researching in all these different countries? And like, what do you really enjoy about traveling all over the world to do research?
Yeah, so I guess I'll briefly go through the timeline of how this happened. So basically, I was originally from Malaysia, and then I decided to relocate to Melbourne, Australia for my undergrad. And then after my undergrad, I went to London for my master's. Yeah, and following masters, I secured a PhD offer here from Peter Mac, but I couldn't travel back to Melbourne due to COVID-19 travel restrictions. So I had to go back to Malaysia and then work as a research assistant and figure out where life goes from there. And then after a year, I was finally able to travel again. So I came back to Melbourne and started my PhD. So I think the best thing about traveling between different countries was the cultural differences that I was able to experience. I think that's really great. And also, I was able to learn about the resources and facilities at different research institutes, which I think became really helpful when I had to decide where to do my PhD. For example, during my undergrad, I learned about the collaborative nature of this Parkview Precinct, which is the biomedical research hub here in Melbourne that consists of multiple hospitals and research institutes, including the Peter Mac, for example. And I was really fascinated by that and decided to come back for a PhD.
That's super cool. Sorry, I'm gonna mute just in case we don't get family life background noises happening at my
Sure.
house, but that is amazing. I'm always really, I don't know, I admire people who do that much traveling for their education. And you get so many awesome experiences that way. And I'm really glad that it also helped you pick where you ended up for your graduate training because that's such a huge decision, but sort of having that knowledge ahead of time and knowing what you really needed out of a research group is yeah, that's really valuable to know before you get into it. So that's really great. Thank you for taking us through that. I guess also on the flip side of that, like, is there any sort of negatives to doing research all over? Like anything you'd want to share with people who are considering it for themselves?
Yeah, right. I think the research part has been great so far. I think it's mostly about the personal life part. Yeah, that's more challenging when it comes to this much of traveling. Of course, it's great that you get to travel and experience different things, but I guess it requires a lot of courage and mental preparation, knowing that you will be almost completely on your own and you have no friends and families there, and the connections that you have to build from scratch every time you travel to different countries. But I still think it's a really great life experience. I would say definitely go out and explore if you can. And yep, I'm planning to travel again for my postdoc, and I can't wait for it.
Wow. Okay. Oh, that's exciting. All right. Well, I'll have to keep posted on where you end up after your PhD, but that is
Yeah.
awesome. That's nice. I'm glad that you take a very, candid approach to, yes, there are going to be aspects about it that are hard, but it's worth it. If you have
Yeah.
the courage to do it and you take that leap, that's awesome. Well, good for you. I did notice. So you said one of your study abroad times was you did your master's degree in drug discovery and development at UCL, right? University College London. Okay, very cool. So then, did that experience lead you into what you're currently studying for your PhD work? And If not, how did you kind of touched on it a little bit, but how did you pick your specific, spot where you landed now for your PhD?
Yeah, so I guess the short answer is yes, but also no.
Hmm.
So my master's research was on biomarker discovery for liver injury, and I'm now working on CAR T-cell therapy for solid cancers. So they are completely different projects. I guess what made me go into cancer research in the first place was after my family members were diagnosed with late-stage cancer, and I realized how limited the treatment options were. And it really made me want to learn more about cancer and also contribute to expanding the treatment options for patients. And that's when I started to look out for PhD projects. And I came to learn about this really cool CAR T-cell project that my current research group at PLMAD was working on from the PLMAD project handbook. So I decided to contact them and express my interest. And even though my previous research was not that relevant to my current research, I think there were a lot of soft skills that were transferable. And it also got me the offer during the interview. For example, during the interview, I talked about my research, and it was my scientific communication skills and also the way that I approach a scientific question that impressed them, I hope. Yeah, that got me the offer.
That's very cool. No, that's great. I mean, I think it sounds like, you landed in the right spot for you. I'm really glad that that was, the path you chose to go. So I want to dig more into your thesis work then. So I mean, your work is so cool. And obviously it won you the top abstract award at the ANZ regional meeting this summer. That was in Queenstown. So congratulations again. And you said that was your first ISCT meeting. Is that true?
Yes, it was actually my first SCT meeting. So yeah,
Ever? You just started with an
yeah,
international one and
I didn't know about ICT until this year when my
wow.
supervisor, yeah, when my supervisor Paul Beavis decided to attend the meeting in Vancouver earlier this year. Yeah, where he also presented about the same work and got a lot of positive feedback.
Gotcha.
Yeah, so that's when I learned about ICT and decided to submit an abstract to the regional meeting.
Wow. Okay. Well, then we can be very excited to see more work from you from here on out, hopefully. Man, you're just getting started in ISCT. That's so exciting. I
Yeah,
remember when I was at your stage, like ISCT is so good for getting connections and for getting involved in the field. Like you'll absolutely love it. I mean, you're already killing it, but I'm so excited to have you be more involved. That's going to be awesome.
yeah,
Okay,
it
so
turned out to
those,
be one of the
oh,
best
sorry, go ahead.
meetings. Yeah,
Sorry,
it
go
turned out to be one of the best meetings I've ever attended. Yeah, that's why I told everyone when I came back. I was like, this meeting is so good. It's one of the first meetings that I've ever had in my PhD so far. Because yeah, the
I
talks
think
was so interesting.
yes. And actually, I misspoke earlier. So it was a regional meeting, not the international meeting, but I hot take always tell people, like trainees especially, that the regional meetings are really great for your first ISCT meeting. I had a North America regional meeting for my first ISCT meeting. And yeah, as like a baby cell therapist, you go in there and all the big people are there, but they'll, just talk to you. Everyone's so nice. It's smaller, it's more, collegial. Like you're just getting introduced to everybody. Yeah. So I'm so glad that was your experience too. And I want to encourage people out there, like, don't sleep on the regional meetings because they are so good.
Yeah, it was great. Yeah.
Yeah, that's awesome. So yeah, for those who weren't fortunate enough to attend the ANZ regional meeting in Queenstown, so your abstract was titled Identifying Optimal Tumor Specific Promoters for CRISPR Knock-in Generated Armored CAR T Cells, which sounds amazing. And I loved reading your abstract and the whole poster. So I want to know, can you share where the idea for this project came from and sort of what the end goal of the project is?
Yeah, sure. So my lab is a armor CAR T-cell lab where we work on identifying armoring genes that could further boost the efficacy of CAR T-cell therapy in solid tumors, given that we currently have no approved CAR T-cell products for that. And my supervisors recognized a need for a strategy that allowed these armor CAR T cells to produce armors only at the tumor site to avoid damage to healthy tissues. And that was how they came up with this idea of using a CRISPR knocking technology to replace an endogenous tumor-specific gene in CAR T cells with an armoring gene of interest, such that the CRISPR engineered armor CAR T cells will secrete the armor only at the tumor site, but not anywhere else in the body to avoid any toxicity issues. So when I joined the lab, my project was to identify the best tumor-specific promoter that could apply this idea or strategy to. And our ultimate goal is to establish sort of a versatile tool that allow us to equip CAR T cells with any armoring genes of interest without having any safety or at least have minimal safety concerns.
I love this idea. This sounds fascinating. And to get to work on it for your thesis project is fantastic. So I want you to tell people more because I thought your promoter selection process for, where to how to get the tumor specific expression of these things was so elegant and smart. So I'm hoping you can share more about how you came to decide on the promoter regions that you did, so people can really appreciate the thought there.
Yeah, sure. So the selection process was like a multi-step approach where we look at different characteristics at a time. But ultimately, there were two properties that we care about our target gene. So firstly, we wanted our target gene to be tumor specific, of course. But there was also another aspect that we look at where we want a target gene that is not essential to CAR T cell survival or function, because we also disrupt target gene during the process of knock-in. So of course, it's even better if we could identify something that's in between to T cell function while at the same time being tumor specific, because it will then allow us to achieve a two birds one stone effect. So the first step to identifying a tumor specific gene was to perform bulk RNA-seq on CAR T cells that were isolated from the tumors and spleen of tumor-bearing mice. And from there, we look for genes that were upregulated by intratumoral CAR T cells compared to splenic CAR T cells. And that was how we identified 27 different tumor-specific genes. Then from there, we knock out each of the 27 different genes in CAR T cells and look at their impact on CAR T cell function and phenotype. And then following the knockout, we were able to narrow down to 6 candidates that did not have any adverse impact on CAR T cell function following knockout. And eventually, that's when we move on to the knock-in technology, where we knock in reporter gene GFP into each of these 6 different genes, and then transfer the resulting CAR T cells into tumor-bearing mice and look at GFP expression by these CAR T cells at different body sites. And this eventually allowed us to find a target gene that supported GFP expression at only the tumor site, but not other non-tumor site that we looked at. And we have looked at multiple non-tumor sites to try to be more thorough. For example, we've looked at the blood, spleen, liver, lung, bone marrow, brain, and I think there's one more, kidney. Yep.
That is a ton of work. I'm so in awe. That's amazing, but so thorough. I mean, were you ever worried that, like, you identified your 27? Were you ever worried that one wasn't actually going to shake out as like a good one?
Yeah, so that thought actually haunted me so much in my first year because that was my main project and I really wanted it to work. I think it's really cool. So in fact, we got impatient during the knockout screening process. We actually picked our favorite target just based on the RNA-seq data, and then we moved straight to GFP knocking just to see how it went. And turned out that gene wasn't tumor specific. And it worried us a lot, but we decided to be patient and we did every single step through from knockout to knocking, and we eventually it all worked out and we found a really good target for that.
Wow.
But
No, I
uh
admire that. It's hard to be patient like that when yeah, with that much work and that much like sequential things that have to happen and taking your time to actually see what's going to work well for you. Yeah, kudos to you.
yeah, but of course I also
Yeah.
had other side projects as a backup just in case if it didn't work. But of course it all worked out fine. But I was also working on other armoring genes rather than just the promoter part. So for example, I was also working on chemokines to try to improve the trafficking of CAR T cells to the tumor site, which is one of the key challenges that limit CAR T cell therapy efficacy in solid tumors. Yeah.
Wow. Oh my gosh. Okay. Well, this is great. I was so then could you tell people what targets you ended up fixating on?
Yeah, so we ended up picking 2 targets. So one was NR42 and it's known to be very tumor restricted. So it's very clean and non-tumor site and it supports a degree of expression at tumor, which allows certain genes to work well without having toxicity issues. And then we also picked another target that we think will be useful for different factors. For example, that was RG16. And that gene supported a really high expression in the tumor, even though it's slightly leaky and non-tumor site, which we think would be great for factors that are less potent, so will require a greater level of expression at tumor site, but it's also probably less toxic, so it wouldn't cause toxicity issues, even though we have a slightly leakiness at non-tumor site. So
Oh,
I think if we have promoters that is suitable for different factors, we could just match with,
okay.
yeah.
Yeah. Oh, no, that's great. Thank you for walking us through that. Um, I had not heard of either of those factors before, so that was really great for me to learn about too. And I'm just curious, like now that you have these factors, you're doing your knock-in CAR Ts, your armored CAR Ts. Um, where do you see this going next? And like eventually, how do you see this technology translating into the clinic? That's what I care about. Like how are we going to translate this right into the clinic, into a GMP space? Any specific disease targets you might start in? All of that.
Yeah, so we do have plans to translate this strategy into the clinic. And in fact, we are currently working with the Center of Excellence in Cellular Immunotherapy at Peter in-house that has the GMP grade manufacturing protocol for CAR T cells to try to test these CAR T cells further in mouse models before we push it forward for phase 1 trial. So we are hoping to start in multiple myeloma first, which is a blood cancer type with approved CAR T-cell product, but there's currently still a gap for improvement in efficacy. And eventually, we still hope to translate this into the solid tumor space.
Okay. Oh, I love it. Do you think you're gonna ever have to go back to the drawing board and maybe pick, like, could you see different targets that maybe you eliminated for this round, like coming back into play if with depending on what expression you're trying to get?
Yes, yeah. So currently, we're still trying to test the pair that we have that works really well, like NR42 with L12, which is the toxic factor, and potent factor that we have seen really striking effects in preclinical models. But yeah, we are also looking into other targets that we excluded further because I think we did see something interesting that we'd like to explore further that might be useful for other factors.
Okay. Well, oh my gosh. All right. We might have to leave it there and you'll leave us all hanging until we see you again. And hopefully you're going to come to New Orleans maybe in 2025. Because we would love to see more of your work. I would love to talk to you even more about this in person. I hope everyone is as excited as I am about going and reading more on this. And we wish you all the best with your PhD project and finishing up there.
Uh,
Actually, can you let people know, if they're interested in learning more or getting in contact with you? How should they do that?
yeah, sure. So feel free to connect with me on LinkedIn. My name's coming up, and I'll be more than happy to answer any questions.
Awesome. Well, thank you so much for spending your morning, my night with me. And thank you to everyone for listening.